Hey ladies, it's Kim Bukta, back to do another video today, and this one's really important to me because this one is kind of something that I see every day in my practice. Again, I am a physician assistant in orthopedic trauma, so I've just been doing these videos to kind of investigate women's health issues as I'm kind of going through this perimenopause, menopause transition to help figure out, what's going to help me be healthy and live a long, healthy lifestyle independently. And I've been trying to share the information that I'm learning because, again, I feel like there's so much information on social media and not a lot of information through your provider. So it's kind of hard to sift through what is accurate and what is not. So this video today is super important. I feel like make sure you listen to this, make sure you share this with all the women you know, because again, this is a video that will really help impact your bone health, and there is not good information out there about bone health and when to obtain a bone density scan, and you need to advocate for yourself to make sure you're getting this done and taking care of your bone health. Because again, ladies, I deal with women coming in every day in their 50s, early 60s with osteoporotic fractures, and they have no idea anything has happened with their bone health. Because again, this is a silent thing that's happening in the background that you have no idea your bones are weakening until the point where you have these fractures. And these fractures are traumatic and they impact your lifestyle and they are just hard to recover from. And we're having to tell these women that, hey, this is an osteoporotic fracture, which we have certain fractures to us that are diagnostic of osteoporosis from a ground level fall. So if you obtain a proximal humerus fracture, which is a fracture of your shoulder, if you obtain a distal radius fracture, which is a fracture of your wrist, or if you obtain a pelvic fracture just from a ground level fall, these are pathognomonic for us for osteoporosis. So even if your bone density scan doesn't show this, it kind of tips you into this osteoporotic category. And again, most of these women have no idea this has even happened and are really shocked and surprised when we tell them that, we need to work up your bone health and figure out what's going on. And again, ladies, you need to realize that osteoporosis isn't something that's just inevitable and it's going to happen to all of us. This is something that you can try to prevent. I mean, again, some of it is genetic, but we can do things to keep our bones strong. And you need to realize that osteoporosis is significant. Each fracture you have, once you have osteoporosis, it reduces your lifespan. It increases your mortality risk. You lose your independence. So women, if you have a hip fracture after the age of 65, it is a 30% mortality rate within the first year. So that's significant. Also, if you have this hip fracture after age 65, only 20% get back to baseline activities. So it's pretty significant that even if you're not, like I said, the mortality rate is one thing, that's the high end of things, but even that, you may not get back to your functional level. So for us, our data shows us that it is hard to get back to the functional level you were at before this hip fracture once you have it at age 65, and usually you reduce a functional level. So if you're somebody that's running around doing everything you like to do, you may need a cane for things, or if you're somebody on a cane, that means you go to a walker. So these things impact your independence, and you really need to make sure you're taking this seriously and that you are advocating for your bone health. Because again, I'm telling you, I'm seeing these ladies and they have no idea this is happening to them. And why is that? It's because our World Health Organization recommends a bone density scan at age 65. This is way too late. Obviously, if you're getting this at age 65, you're already in that osteoporotic category. And why is that? For women, as soon as estrogen's kind of leaving the building, so a year before we hit our last period and 2 years after this, we have this rapid decline in our bone density. So our bone health just declines hugely during this time. And then after that, it kind of does the slow decline after that, kind of more at the steady state of men. But again, this is something that you have no idea is happening in the background. So you need to be aware of this. And if we're waiting until we're 65, we've kind of missed that key period when we can actually do something to help our bone health. So I want to kind of go over today on when we should get a bone density scan. So I've actually kind of chatted with our bone health group at the university I work at. So I'm at a level 1 center in Madison, Wisconsin. So I've talked with our bone health group kind of on their recommendations and kind of what we're seeing. Again, there's no guidelines to this. So this is just not really out there. So you really need to make sure you're advocating for this yourself. So what is the test that measures your bone health? It's called a DEXA scan or bone density scan. And this just measures the strength of your bones. you're looking at your T-score, so you're looking at a comparison to kind of your young healthy bone, and when you obtain this kind of peak healthy bone is kind of in your 20s and 30s. So it's comparing you to that kind of 20-30-year-old healthy bone. So you're looking at your T-score for women that are postmenopausal, and this is, you're either going to fall in a normal range or osteopenic range. And the osteopenic range is from -1.0 to -2.5, and then greater than -2.5 is considered osteoporosis. So that's kind of the range and what people are looking at when we get these bone density scans. When should you get a bone density scan? So for women, you should get one as soon as you're hitting menopause. So I feel like baseline should be at onset of menopause or age 50, I guess whichever one comes first. You should get a baseline bone density scan to know where your bone health is. Now, there are some women that should actually be getting this in their 40s if you have risk factors. What risk factors would those be? Like if you were a smoker, if you have gone lengths of time without a period, that means you've gone without estrogen. If you've been a smoker, if you have thyroid disease, so any kind of rheumatologic disease. So there are many things that may mean you should actually get a baseline in your 40s to check your bone health to make sure you've not had any loss of bone health even at a younger age. But for sure, at minimum, it should be when you hit menopause or 50, again, whichever comes first. And now, if your bone density is normal, so if you're well in the healthy normal range, I think, doing your bone building protocols for lifestyle changes is important. And remember, I've gone over these in the other videos, but just kind of a quick recap is, getting calcium in your diet, making sure you're getting adequate vitamin D, making sure you're getting adequate protein intake. Remember the 1 gram per ideal body weight per day. Make sure we're doing our strength training exercises, and then even maybe some jump training. But again, at least if we're getting that good base of strength training, protein, calcium, vitamin D, that's kind of a good basis to kind of get that strength and maintain those bones. And then when should you repeat a bone density? If you've got that baseline and it's like healthy in the normal range, probably in 5 years, just to check on where you're going with things. Now, if you get this first bone density scan and it is at the low end of normal, what should you do? You should, again, implement your lifestyle changes. And again, that should be in any category. It doesn't matter if you're normal, osteopenic, osteoporotic, you should be implementing these lifestyle changes because these can all help with bone health. And there's been studies to show that. If not building more bone, at least maintaining what you have. So women, even in the osteoporotic category, can start strength training. They just have to do it safely, with a trainer and under advisement. But everybody should be doing this. But if you're, again, in the low end of normal, do the lifestyle changes. And then I make sure you're meeting with, a menopause specialist or your primary care provider to talk about menopause hormone therapy. Ladies, menopause hormone therapy will maintain your bone health. So that is proven, it's FDA approved to maintain bone health. So again, it's been shown in the Women's Health Initiative to reduce your fracture risk, remember, by 20 to 40% and prevent bone loss. So again, this is FDA approved for this. So if you don't have contraindications and you are in this, under age 60 or within 10 years of menopause, starting menopause hormone therapy can maintain those bones. So, and if you're at the low end of normal for your bone density scan, you should repeat that in 2 years. You shouldn't wait 5 years to recheck it. It should be every 2 years once you're hitting that low end of normal, once you're hitting an osteopenic range or an osteoporotic range. That's it, rechecking your bone density scan every 2 years. Now, if your bone density is in the osteopenic range, again, remember that is -1.0 to -2.5, you should, again, be doing your diet, lifestyle modifications that we talked about. You should be talking with a menopause specialist or your primary care provider about, are you a candidate, again, for this menopause hormone therapy? And again, you might need to go to a menopause specialist to get on this, but this is FDA approved to maintain your bone health. So we should be talking about that. And you can stay on this medication longer. So again, there are a lot of agents out there that working with our bone health group that can build your bone or maintain your bone. And I'm not going to go over all of those medications today because there's so many of those. You need to actually meet with a bone health specialist or with an endocrinologist to discuss if you're a candidate for these. But a lot of these agents you can only be on, 2 years to 5 years, and they're having to cycle through these, where menopause hormone therapy, you can stay on it as long as you want, as long as you're not developing contraindications to this. So this is a therapy that you can stay on long term to keep your bones. Now, as soon as you stop it, you go back into that loss of bone. So you lose it as soon as you stop it, but as long as you're on it, you're maintaining your bone health. So if you're osteopenic, you should be meeting with a menopause specialist or your primary care provider or your women's health expert to talk about, could I start menopause hormone therapy to maintain what bone density I have? And I also think it's beneficial to meet with, again, a bone health group or an endocrinology group to, again, assess should they start some of these other anabolic agents to try to build your bone stock back in these earlier years to prevent you from kind of further declining. So again, menopause hormone therapy and talking with a bone health group to see if you're a candidate for some of these other medications. Now, if you are already in the osteoporotic category, you really need to make sure that you are advocating to find, a group, a bone health group, or an endocrinology group that can go over these newer medications. Again, there's a lot of medications out there, and it's hard for primary care providers to keep track of all of these for bone health. So it's worthwhile meeting with somebody that just does this for their specialty, because they can go over some of these newer medications that actually can strengthen your bones, not just maintain your bones. So it's really important, if you are already in the osteoporotic category, that you are requesting to meet with specialists that can go over these agents that can build your bones. And then again, if you are within 10 years of menopause or you are under age 60, you should strongly consider menopause hormone therapy if you don't have contraindications for this, because again, this will maintain what bone stock you have, so you won't continue to get weaker bones. So ladies, I can't emphasize this enough, the significant impact these fractures have on people's lives and how devastating this is to see women just get debilitated and end up in nursing homes and not be able to get back to doing the things they like. And again, they have no idea this is happening to them because no one's told them to check their bone health, because our guidelines say age 65. So again, I want you to listen to this video. I want you to share this video with all the women you know so that they're all aware of this and they are checking on their bone health. So again, we need to get bone density scans earlier. So we want this, remember, age 50 or when you hit menopause, you just need that baseline. And it may be earlier. Like I said, if you have risk factors, you should be getting a baseline in your 40s to check your bone health, because there are younger people that have bone density scan problems just from our diet and the way we're growing up. So it is important. If your primary care provider says that you're not a candidate, out of pocket, it might be like $200. It's worth investing the money to check your bone health. I can't reiterate enough the impact this has on your independence and your overall health. So please share this with women you know. Again, if you like these videos, please hit like or subscribe, and we'll continue to try to make more videos to help educate us on our health as we're aging to stay active and healthy. Until next time, ladies, thank you.